Hello and welcome to this LEMAlab Q&A number 2. So back on last week Q&A, how long does it take for flexible to work? We did gather more evidence and research. I forgot to mention that flexible needs to be taken on a daily basis in order to have these benefits. It is not a medication, it is a supplement, so it needs to be taken daily and not sporadically. For muscle soreness and stiffness post-recovery workout, you should see effect from 2 to 3 weeks. When it comes to skin, hair, nails, 6 to 8 weeks, but some see obvious effects also after 4 weeks. However, 6 to 8 should be more of a timeline. For joint pain and prevention, you have to give your body time to assimilate and start producing more collagen on its own. Evidence and studies talk about as of 8 weeks. Flexible is a healthy habit to adopt on a daily basis from now and forever. Question number 1. Does MSM help with muscle? MSM is a chemical found naturally in plants and animals. It supports the immune system and the body's ability to repair connective tissues. Additionally, it is also a potent anti-inflammatory, commonly used to treat osteoarthritis and tendonitis. Now, how does it help muscles? First of all, it decreases exercise-induced oxidation, and it is thought to be the underlying reason for reductions in muscle damage and soreness. If you consume MSM before exercise, you might be less sore the day after training. It also speeds up exercise recovery. Researchers determined that MSM can help athletes recover more quickly from hard training sessions. And lastly, biomarkers of muscle damage, such as creatinine, are decreased following exercise with MSM. Question number 2. Can you explain how it helps with joint pain? What causes joint pain? There is a number of reasons, but let's talk about the most common ones. Everyday activities do produce some wear and tear on the joints. People who have sustained sports injury will obviously be at greater risk of degeneration of their joints. Bursitis, or inflammation of the cushioning pads around joints, as well as tendon inflammation, will also be painful. So as you get older, your body makes less collagen, therefore is less resilient, and you need more time to recover from training. You will probably feel more joint pain or stiff tendons and ligaments. There are many types of collagen. The type of collagen peptides chosen for flexible is involved in building skin, bones, tendons, ligaments, and muscle tissue. It also contains glucosamine, that is known to slow down joint degradation and accelerates the recovery from tissue injury. MSM, as we just discussed, helps with inflammation and muscle damage. Bromelain, when it is in the stomach, will help the body break down and digest proteins. It is a natural anti-inflammatory, which helps also with joint pain. Question number 3. Is it a myth that flexible and collagen helps cellulite? No, it's not a myth. LEMAlab has chosen not to promote the benefit, although from the data in the scientific literature, it is quite real. Clinically speaking, cellulite is a fat globule under the skin that just pushes the connective tissue out of shape. So as we age, our skin loses its elasticity. It stops stretching so well, and cellulite is more visible as a result. Even lean people have cellulite, although it affects more women. Actually, 85% of active women complain about it. Collagen strengthens the connective tissue of the skin, and because the cellulite is primarily a problem of fat pushing the skin's connective tissue out of shape, it will help. Plus, collagen can help hydrate the skin from the inside, and cellulite appears worse when the tissue is dehydrated. Question number 4. Is it also for men, and what are the specific benefits for men? So, men will benefit from collagen just as much as women, but they often have their own peculiar interests. A lot of men are concerned about hair loss, and because the benefits of collagen also include helping to support healthy hair and hair thickness, Some men might be attracted by collagen for that very reason. However, the other benefits will still apply: skin, joint health, and the amino acids that will help them maintain their muscle mass. And finally, question number 5, can older people consume flexible? Anyone with a health issue must first consult with their doctor before adding a supplement to their diet, as we know. That said, the older population will benefit largely from the daily consumption of flexible. In fact, as we age, we lose bone density, so bones become more fragile, including in the spine. Collagen will help delay that process. We also lose muscle mass, a condition named sarcopenia, which is the gradual decrease of muscle mass, already starting in our 30s, but can become quite problematic for health in the older population. Collagen peptides mixed with resistance training is a healthy option. For people with knee osteoarthritis, flexible might act as a mild pain reliever and improve joint function. It might also help to delay further degeneration of their joint. Take into consideration that it might take from 3 to 5 months for these improvements to be seen or to be felt. Thank you for your questions, and see you next week for Q&A number 3. Have a flexible day.